Thank you so much. We are so glad to be here with you today. I'm Hamutal. I'm going to ask Diana to share the slides. Awesome. Thank you. Let me get it right on my screen. So, it's so great to be with you. I'm Hamutal Bernstein. I'm a senior fellow at the Urban Institute. I co-led this study with Jenny Haley, who is in the Health Policy Center at the Urban Institute. And we also partnered with Krista Pereira and Hannah Gill at UNC. We're really excited to be with you and kind of get your reactions. I'll start off introducing the study and sharing some key findings. Jenny will share some of the recommendations and solutions to promote a stronger safety net. And Diana will share some focus group findings and some next steps. And we look forward to Q&A with you. Next slide. Thanks. So we know that many immigrant families don't take part in safety net programs like Medicaid or food stamps, even when they have eligible family members like U.S. citizen children. There's a lot of reasons, and we know this has gotten worse in recent years with changes to the public charge rule. And the state of North Carolina has a very large and diverse immigrant population with a decentralized safety net agency system that varies in capacity across the counties, which you all know about. We really wanted to work to understand the barriers that families face in accessing these types of programs and the experiences of the health and human services agencies and other community-based organizations that connect families to the programs. So to do that, the study had a couple of components. Our qualitative research included 42 interviews with stakeholders at the state level and at the county level for 4 counties, Catawba, Forsyth, Pitt, and Wake. We spoke with staff from state and county level health and human services agencies, immigrant serving CDOs, refugee resettlement organizations, FQHCs, consulates, and other organizations that touch immigrant families. We partnered with 4 CBOs to lead 4 virtual focus groups, 2 in Spanish, 1 in Hmong, and 1 in Swahili with Congolese refugees. The partners were USCRI, North Carolina Hmong Women Association, El Centro Hispano, and Centro para Familias Hispanas. We also incorporated 2 virtual listening sessions with stakeholders to gather input on initial findings before finalizing drafts. And there's also a large component analyzing American Community Survey data to develop a county-level data tool that highlights key statistics on immigrant families. We ended up producing a report, 3 fact sheets, each one focused on the experiences of a different group, the data tool, and Krista and colleagues at UNC also developed 3 PowerPoint slide decks with updated demographics on immigrants, the children of immigrants, and the Asian population in the state. Next slide, please. So these are the big takeaways. In addition to the universal structural barriers that many program applicants have to handle in enrollment processes, immigrant families face additional unique challenges specific to their immigration status and language backgrounds. Immigrants serving CBOs and community health workers playing a very important role in supporting families' program access, filling in key gaps, but they are facing challenges related to capacity and funding. And facing limited resources and complex rules, state and county level health and human services agencies also are facing challenges in supporting families. And we end up highlighting a number of solutions, really for state and county agencies that could perhaps make up for some of these challenges. Next slide. So quickly sharing some of the findings. Like all enrollees, immigrant families have to navigate very complex processes to access these safety net programs like Medicaid and food stamps. That includes learning about programs and attempting to apply, drawn out paperwork processes with unfamiliar terminology, wondering whether they're eligible or will ultimately get enrolled, all while arranging time away from work and other responsibilities to spend time navigating that system. So we heard about limited awareness and stigma, challenges around transportation and scheduling, communication and technology, as well as benefits cliffs, long wait times, and trade-offs in engaging with these systems. And I share a quote here from one CBO stakeholder that really highlights the limited awareness and knowledge of systems. Maybe I will give the interpreter some time to translate the quote. Oh, okay, well, that makes things easier. So the quote is, for those that are eligible, it's the unfamiliarity with the healthcare system in the US or with understanding Medicaid or understanding WIC. Thank you, Dana. In addition to those universal structural issues, immigrant families are facing additional barriers. First, around language access. So language access came up in every interview and focus group, particularly for immigrants who speak languages other than Spanish. Though there may be Spanish translations of many materials, other languages are less common. And even if applications are available in non-Spanish languages, they may not be used because agency staff are not aware of their availability or how to process them. Follow-up communication by mail and telephone is generally in English, which puts the onus on applicants to seek out help from resettlement agencies, CBO staff, family members, or other people to help them navigate these processes. We heard a lot about the lack of bicultural and multilingual staff in the health and human services agencies, where many immigrant families do prefer to access help in person rather than by phone or online. And this quote from a stakeholder really highlights how clients can get frustrated and give up when they're handled by agency staff that do not have the capacity or training to support them. The centers or departments, they do not have bicultural and language trained staff. That's where we see the greatest challenge. Next slide. The next big challenge is immigration-related fears and hesitancy. People being afraid of potential exposure to questions about immigration status for themselves or a family member, fear of sharing their information or being flagged to immigration enforcement authorities. Many stakeholders described the climate of fear that immigrant families faced during the Trump administration and continue to experience, especially in counties where local police cooperate with ICE. Public charge was raised by nearly every interviewee, and the increased reluctance of families to take part in programs because of that policy. A lot of stakeholders discussed the lasting impacts of the public charge rule changes under the Trump administration. And this quote puts it well, even though it was only implemented for a short amount of time, it did its job in the sense that it instilled fear among immigrant households. And from what I've seen working with community health centers, there remains a reluctance. Even though we led these interviews well after the new version under the Biden administration had been put in place, there was very little sign that stakeholders were aware of the change to the public charge policy. Next slide. Last, immigrant families face unique barriers because of the complexities of eligibility in mixed status families. Many times in a family, some members are eligible, others are not. One child may be, but another child is not, or someone may be eligible for one program, but not another. There was confusion around a range of things, including new populations showing up. People brought up Venezuelan and Ukrainian humanitarian parolees, for example. People raised challenges providing documentation to prove income or ID. And we also heard about unique challenges for migrant workers and their families who are more transient, as well as considerations for multi-generational households, which I think Diana will return to later on. Next slide. Last, we heard about experiences of hostile or discriminatory treatment by staff members at Health and Human Services agencies. This quote puts it well from a CBO stakeholder. Immigrants are just not seen as deserving of a service. In some counties, even though I'm documented and have every right to this service, or my child has the right to this service, regardless what my background is, the Department of Social Services are not always friendly and will make it very difficult. I mean, clearly my child is entitled to it, but staff seem to be saying, I'm not going to talk to you because you people don't belong here or you don't speak English. Next slide, please. We also were interested in the experience on the service side, and we consistently heard that immigrants serving CBOs are offering key supports for applicants who are facing these wide range of barriers. They're doing outreach, they're completing applications on behalf of families, they're translating documents, contacting agency staff, responding to letters, sending reminders, attending appointments, providing interpretation, really bridging the gap for families and helping them navigate these complex systems. And of course, they provide trusted spaces with the linguistic and cultural capacity that's needed. And the Health and Human Services stakeholders say that they're very appreciative that these organizations are playing this intermediary role. Similarly, community health workers, which I know is a big focus of this group, were highlighted consistently for their effectiveness in connecting families to health services and safety net programs. Their rootedness in communities, ability to meet clients where they are, make them strong, trusted messengers. And we heard that the state saw this work well with the COVID vaccination efforts. But as you all know, the funding for community health workers is changing with the end of COVID-19 resources, and the CBOs continue to be underfunded with also inconsistent sort of presence and capacity across the state. Stakeholders did urge Health and Human Services agencies to fund CBOs and pay for this intermediary role and function that they're playing for families and connecting immigrant families to these safety net programs. From the Health and Human Services side, we heard about how strapped these agencies are to serve clients. Big problems are of understaffing, staff vacancies, turnover, and context of increased demands in the COVID and post-COVID era. And there is varying capacity and resources across the state. We heard there's inconsistency in assessing eligibility of immigrant families, that the eligibility determination process is very long and keeps people waiting despite urgent need, and that training is decentralized and staff have trouble staying on top of changing policies and new immigrant groups and other changing dynamics on the ground. I'll pass it over to Jenny. Thank you.
Thanks, Amatal. So now we'll turn from some of the barriers to findings on policy priorities that could foster improvements in safety net access for immigrant families. The report lists dozens of ideas that emerged in the research for state and county offices to consider implementing. We grouped the solutions that were identified into four main themes related to addressing immigration-related concerns, simplifying processes, improving language access, and forging connections across various programs. I will go through a few examples of each of these, but as I said, there are many others in the report, which we will share with you afterwards. So first, we heard about solutions to address mistrust and immigration-related concerns. Some example changes for state and county agencies to consider included to hire more diverse staff who represent immigrant populations. This would be especially important for county-level agencies to identify and hire staff who represent the specific immigrant communities in their local area who might be more trusted by families to share accurate information about immigration-related rules and ease families' worries that participating in public programs could have immigration implications. As Hamatal shared, we heard a lot about the role of community health workers who share identities with their clients and have firsthand experiences with programs. And we heard that stakeholders really identified the need to leverage funding that's available to support these community health workers so they can serve as in this intermediary role. Third, we heard about specific needs for state and county agencies related to outreach. First, we heard about the need for outreach that is welcoming and that encourages immigrant families to apply. And second, we heard that outreach and educational materials need to include clear and accurate information about complex immigration eligibility rules for the public, especially for varying immigration status qualifications, which are quite complex. And that complexity can serve as a barrier, and making sure that it's clearly communicated can help address families' concerns. The second theme that arose is the need for simplifying complex enrollment and re-enrollment processes. A first example is related to ePass, the online application portal in the state. We heard about logistical challenges in the interviews and of the need for state and county agencies to seek input from the organizations who are assisting immigrant clients with that platform on what they see as needed improvements. Another idea that arose related to the variation in levels of knowledge of caseworkers across the different counties in the state was for the state to mandate consistent staff training across counties on enrolling and serving immigrants, including on those complex immigration eligibility rules. We also heard about a role for the state in fostering connections across different county agencies and facilitating shared learning in how to best serve immigrant clients. And third, directly collecting feedback from clients on their experiences. This could identify common obstacles and target improvements to the processes, about the logistical hurdles they face, but also assessing experiences of discrimination and mistreatment that could add to these other enrollment barriers. Next slide, please. Thanks, Diana. The third theme, the need to remove language access barriers, particularly for languages other than Spanish, arose again and again, as Hamatal said. State and county actions could include to hire and retain more bilingual and multilingual staff, such as through explicitly encouraging speakers of non-English languages to apply in position listings, and ensuring that compensation is commensurate for the expertise that these staff would bring to the table. Ensuring that translated materials are available and understandable for everyone, including for people with lower literacy levels in the language that they use, and culturally relevant for different immigrant groups in the state or the local area. And third, funding targeted multilingual outreach efforts that particularly work with community-based organizations to reach underserved immigrant populations, especially in non-Spanish languages, ensuring that the communities in a local area are specifically targeted. And then a final theme is making sure that state and county agencies are ensuring that immigrant populations are able to access all the types of assistance that are available. NC Care 360 is the state platform to connect people to a broad range of community resources. We heard about the need for expanding the number of immigrant serving organizations and other resources that are a part of the platform. And then another idea in this theme was to co-locate multiple social service agencies together to make it easier for immigrants who are applying, and especially to locate that assistance in places that are frequented by immigrant families. As I said, that's just a sampling of some of the things that have emerged. On the next slide, you can see that we go into a little more detail on what we thought were 6 solutions that arose in the research as particularly important. And these include the following: customized engagement and outreach by government agencies. Government outreach can convey welcoming messaging that clarifies who's eligible and reassures families about their immigration-related concerns, such as public charge. And outreach should be customized to the needs of different communities. Diana will speak soon about some of the findings on variability and needs that emerged in our various focus groups. Supporting language access needs beyond Spanish. Collecting input from organizations supporting families is one way to gather information on emerging language needs, in addition to being attentive to expressed preferences for languages among current enrollees and their families. Also, a theme that emerged was the need for attention to in-person supports, given that we heard that many immigrant families prefer in-person interactions with agencies. Then partnership with immigrant serving organizations and community health workers. This would ideally be accompanied by funding for these organizations and individuals to support this important work. Diversifying agency staff, and that's not just about hiring, but retaining, and that would include ensuring equitable work environments. This could be accompanied by more expansive and consistent training of staff and provision of support resources. So this would not only improve the customer service that caseworkers can deliver, but might reduce their workload and potentially help with retention in these roles. Simplifying program enrollment and retention processes. This would, of course, have benefits for other populations beyond immigrant families. And this would be particularly important right now as the state is implementing Medicaid expansion. And finally, we discussed state action to expand eligibility to different immigrant populations. So, for instance, unless federal legislation changes, the state could use state dollars, like some states do, for instance, to cover additional immigrants, including undocumented non-citizen children or adults, in state-funded health coverage. And that would give more immigrant families access to the supports that they need. So now we'll turn from solutions to some of the findings on the focus groups, and I'll hand it to you, Diana. Thanks.
Thanks, Jenny. So as both Jenny and Hamilton mentioned earlier, we held 4 focus groups in 3 languages, and this provided just different insights for each group. So I'm just going to highlight a couple of the main findings for each of the groups here. And so for the 2 focus groups held with Spanish speakers, which primarily contained mixed status immigrant family members, one of the main concerns that they highlighted was the immigration concerns was the main challenge that they highlighted. And kind of included in that was the public charge policy. And so just generally being afraid of what those consequences would be, but also having a misunderstanding of the eligibility as well. And also for this group, we found that there were challenges related to showing documentation of income. And so this came up frequently when there was a household member who was self-employed. And so being able to show, documented pay stubs, but also for household members that were engaged in seasonal work or who were in fields where there were just high and low seasons. So ensuring, again, that they could provide documentation, but also that it would be their seasonal work would be recognized and not necessarily disqualify them. And then for the Swahili speakers or the Congolese community, all of the participants arrived as refugees, and some had been in the country for a few months. Some had been in the country for about 4 years, or a couple years to 4 years. And so again, similar with refugees who arrive, they received formal assistance, right, with their resettlement agency upon arrival and enrolling to safety net programs. But their challenge to stay enrolled or re-enroll was highlighted as well in these conversations. They also reported lack of language access, and so mentioned that they received materials in English and Spanish, right, but not in their language. And so that was something they raised. It also the burdensome process that they needed to engage in terms of submitting paperwork or scanning things was also raised. And then for the Hmong community, many of the participants of this focus group were second generation. And so they discussed how they helped their parents through the process, or tried to help their parents through the process, oftentimes navigating websites in order to, understand how exactly to enroll in the process. And so while sharing that this process was overwhelming, having to navigate the website, also raised the fact that their elderly parents didn't have language access or face language access obstacles in terms of either written materials or staff at these agencies. And then the other main finding with the Hmong community was their concerns that living in intergenerational households would deem their parents ineligible. So many discussed how they cared for their parents, and they needed more guidance around these types of living situations. So holding these focus groups really with diverse groups of immigrants really helped us better understand again the unique challenges that they face, but then offer policies and practices that could address those. And just at the end here, so I'll just also end with sharing that we have several links to all of the data that you've heard about today. So we do have a report, and we have a data tool, which is on a landing page with all of these resources. And again, we have the fact sheets for each of these focus groups, and we also have them translated in Spanish, Hmong, and Swahili. And then we also have on that landing page link to we have the 3 PowerPoint presentations that were mentioned earlier with demographic information on immigrants in North Carolina, children of immigrants, and then the Asian population in North Carolina as well. And just stop here and